Medicare's open enrollment is happening now. Here to give us all the necessary information from Alignment Health Plan, we welcome Christina Simons.
Thank you very much, Bree, and welcome to the Village family.
Thank you. I love being here. It's so fun.
Yeah, so right now is an extremely important time. This is the time, it's the annual enrollment period, which started yesterday, October 15th, and goes until midnight, December 7th.
Okay, I'm going to write this down because I know nothing about Medicare, so I'm excited you're here. You're going to inform me and tell all of our viewers what it's all about.
You got it. So October 15th to December 7th, and this is the time where Medicare eligibles have the opportunity to shop around and choose different types of Medicare options that best suit their needs, which include Medicare Advantage products like an Alignment Health Plan. And the advantage of a Medicare Advantage is that we offer a lot of additional things that original Medicare doesn't cover. And depending on the type of needs that best suits the senior, there's different types of Medicare Advantage products such as HMO. There's a Part B rebate plan. There's PPO options, which give a little bit more flexibility for a senior to go what we call in or out of network, as well as chronic special needs plans as well, which are very important. So
you've got all the basics covered.
Yes, all the basics covered there. Absolutely.
So tell us, why should people choose Alignment?
You got it. Well, Alignment's been around for since 2013, and what I'm truly excited about is that we are homegrown right here in Orange County. We proudly service over 170,000 seniors across 5 states. And
that's remarkable.
I know, and 98% of our members are in a 4-star or higher rated plan. So Medicare rates plans by stars, and the highest you can get is 5, and we actually have 2 5-stars in both in North Carolina and our Nevada markets, and 4 stars right here in California.
Congratulations, that's amazing.
Yes, absolutely.
Anything new happening for 25?
A lot of new things. So a couple things that I just want to call out is some of the differentiators too that Alignment offers. So with a typical health insurance plan, you have a network of doctors and hospitals you can go to, and then either some type of copay or co-insurances as you receive those services. The good news is right here in Orange County, Alignment has a very robust network, including access to Saddleback Memorial Hospital. We have plans that allow for Memorial Care Foundation, UCI, Hoag. So a lot of great opportunity for access to a network. Absolutely. The second part of that, though, is what the copays and costs are available. Now, one of the differentiators with Alignment is that we have 24/7 concierge service available to all of our members. No matter how big or how small the question is, they can actually call into our member service team and have a live representative help them to either navigate or understand their benefits, or again, if they just have general questions as well.
Well, I can see how this can be extremely confusing to a lot of people.
Yes.
And, especially if you've never been in the enrollment before. And I mean, there's just so many questions. So I love that you offer the 24/7 concierge service.
Yeah, and it's the way we actually promote that as well is all of our members receive not only just a member ID card, which is standard with all health plans, but we also give them, and we were the first to come out with this idea, what we call our Access on Demand Black Card. And this Black Card is really special. It has the member's name on it as well as a Visa logo.
Really?
And on the black, a magnet strip. Now, depending on the type of plan that they choose, and I mentioned we have a lot of different types of product depending on the type of needs that are available for the senior. A lot of our plans offer additional supplemental benefits, such as over-the-counter vitamins and supplements, or even a grocery benefit, or maybe they want to enhance an allowance to get more dental, vision, hearing, things that, again, aren't typically covered by Medicare. Depending on the plan, we actually will load whatever dollar amount is allotted to them, and of course, if they have to meet certain criteria, depending on if they have a chronic condition, et cetera. But these dollars are automatically loaded onto this Black Card, and they can take it to participating retailers to go collect their over-the-counter items or go buy groceries. And we have over 50,000 retailers participating nationwide.
So it's almost like they get a credit put on the card, right? Which then they can use, like you said, at any of the participating retailers. That's amazing.
Absolutely, yes.
That's kind of unheard of, right?
Yeah, and another differentiator I want to just quickly high level as far as being new as well is you're going to see something very unique with Alignment. We design a lot of our benefits to better fit the needs of what we experience and what we see with our own current members and what they may be going through. So I want to tell a quick story.
Sure.
One of the benefits we designed is, believe it or not, pet care. Who has pet care as an option as part of the health insurance?
There's not a lot.
Not a lot. All right, well, let me explain why. We actually had one of our members that was in the hospital, and he was very insistent to get home. And the reason why is that he didn't have anybody to help take care of his four-legged furry loved one, his little doggy.
His little fur baby.
So we literally took action and were able to make sure that the dog was properly boarded. So we do offer these types of services if our members are in need or if they're hospitalized, et cetera. And again, whether it's helping to support, a four-legged loved one who is such an important part of the family, and it brings such a quality of joy and companionship. We want to make sure that we can reduce any burdens, which even includes not even just boarding, but even dog walking if they need help with dog walking.
Well, it really relieves the anxiety off of the patient, right? Because yes. I'm a cat lover. I have two cats, and I don't know what I would do if I didn't have somebody taking care of them.
Yes.
So that's a step above and beyond.
Yes.
So what should someone do if they want to learn more about Medicare Advantages through Alignment?
Well, they can call their local licensed agent. We also have this phone number here at 888-979-2247. But Bree, if we have a little bit more time, do we have a little bit more time? I want to segue kind of into one of the biggest changes that a senior needs to look for.
Would love to hear about it.
All right, so real quick, and this is policy driven. So there's something called the Inflation Reduction Act, which many people have heard of. Last year, they made sweeping changes to help the Medicare recipient receive lower cost and a cap of $35 for their insulin.
Wonderful.
Not only is that included, but there's a part 2 this year, which I think is going to be the biggest disruptor for Medicare folks needing to look at their current plan today, tied to their Part D, which is their prescription drug coverage. They've reduced the coverage gap, meaning no more donut hole, and also the $8,000 maximum out of pocket has been reduced to $2,000.
Really?
So that's good, but it's also a concern if you're not with a plan that has consistent stability with Part D. We did not change any of our tier structures for Part D from 2024 to 2025. A lot of our competing health plans have introduced what we call co-insurance for some of these medications. So that means instead of paying like a tier 4 that these medications can be thousands of dollars. I'll take a $1,000 example. When they go to the store or pharmacy to pick up their medicines, what's going to happen is that they may have a 30 or 50% co-insurance buried in there, as opposed to paying either a $75 or $100 flat copay, which is what they typically pay today on many of our different types of Medicare Advantage plans. They will have a shock January 1st going to the pharmacy and having to pay 50% coinsurance of that retail cost. So if you have a $1,000 drug, it could be a $500 copay at the time. And they would continue to pay that until they reach that $2,000 maximum out of pocket. So just be cautious about that, and you wonderful Medicare beneficiaries out there, please make sure that you're looking into your Part D for 2025.
Yes, a lot goes into this. Wow.
Absolutely.
All right, folks. From Alignment Healthcare, Christina, thank you so much for joining us today.
Thank you.
And still to come, we have India Club coming up. Get your dancing shoes on. We'll be right back.